We good? I got the thumbs up. Good afternoon. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Wednesday, June the 2nd. We're into another month of life with COVID-19 and reaching another exciting milestone here in the province. 300,000 Newfoundlanders and Labradorians have received their first dose. I was fortunate to get mine yesterday, and I was so impressed with how well organized the clinic was. Thank you to everyone working hard to get these important vaccines administered in a timely fashion. In particular, thank you to each and every one of you who have already gotten your vaccine. Please keep it up. Getting Newfoundlanders and Labradorians vaccinated is the key to a return to a more normal sense of life. A big part of that involves the reopening of Newfoundland and Labrador to travel. And I'm so happy to be able to announce that plan today. Dr. Fitzgerald and her team at Public Health, Minister Haggie, and the Department of Health and Community Services have put together a path to being more like the province was before COVID-19. It's called Together Again. And that's exactly what it does. Now, before I even go into the plan, I have to stress that this all relies heavily on people getting vaccinated here at home and those coming to our province. The phases of the plan are contingent on certain vaccination levels, ones we are reaching with second doses now underway here again in Newfoundland and Labrador. Like everything during this pandemic, it's fluid and dynamic. If there are any concerns or any potential problems with variants or clusters popping up, we will absolutely consider changes, as we've shown we can do in the past. We have shown our ability to quickly and decisively react and act when needed, and we will do so again. The alert level system Dr. Fitzgerald and her team have created and the public health measures we follow have proven themselves effective time and time again. And much like other provinces across the country, thanks to continued vaccinations, we are confident we can start the transition this month. As early as July 1st, when roughly 75% of people over the age of 12 are vaccinated with at least one dose, and there are low COVID-19 case count numbers and low hospitalizations, we are excited to lift the travel ban and welcome recreational travelers to Newfoundland and Labrador. Fully vaccinated Canadians will not have to get tested or self-isolate. Partially vaccinated Canadians must present a negative COVID-19 PCR test result administered within 3 days of their departure date or self-isolate following arrival until the receipt of a negative test result. Unvaccinated Canadians will still have to self-isolate for 14 days after arrival. Newfoundlanders and Labradorians returning home from out of province will have to follow the same rules based on their vaccination status. These include rotational workers and essential workers, and are frankly a little different if you're coming from an outbreak site. If all goes well, there will be additional changes as early as August 15th. I know the media received the plan earlier and had a technical briefing with the opportunity to ask questions, and all the details will be posted online. So I won't go into all the specifics right now. But please, take the time to read it and to share it with friends and families, especially those who may not have easy access online. My friends, what a great moment this is after everything we've all been through. Now I know the idea of opening may seem a little scary to some, so I want to stress again that your health and safety is our top of mind concern, and we will adjust and change if required. Grandparents can now come home to meet the newest additions to their families and hold the little babies, hug the grandchildren they've been longing to hug for so long. Loved ones can finally get together to grieve anyone they have lost since the time of the pandemic and travel restrictions became necessary. Friends and family can reunite, share laughs, stories, and make new memories together again. We are also so excited to be able to welcome tourists back to Newfoundland and Labrador. Big news today for our tourism operators, businesses, and everyone involved in our local economies who have suffered so much. We have so much to offer here in Newfoundland and Labrador, from the incredible landscape to the warm hearts of our people. Let's share that message. Now with that, I'll turn it over to Dr. Fitzgerald for today's update. Thank you.
Thank you, Premier, and welcome everyone. This is a day many people have been waiting for. The reopening plan is a major milestone on the path to living with COVID-19. After a long 15 months, this is the strongest signal yet that the worst may be behind us. As the third wave is starting to subside across Canada and the level of protection in our population improves through immunization, we must find a way forward in returning to a new normal. The health and well-being of our province will continue to be our primary focus. The plan to ease restrictions is contingent on COVID epidemiology, vaccination rates, and other emergent evidence. And we expect that new cases will emerge from time to time. And if the epidemiology warrants a change in alert levels on a regional level, we will make those adjustments. This too is part of living with COVID-19. Since the media advisory yesterday, we have 17 confirmed cases of COVID-19 in our province. In the Eastern Health region, there is 1 case related to travel. In the Central Health region, we have 4 cases, 3 of which are contacts of a previous known case and are connected to the cluster in the Central Health region. 1 case is related to travel. In the Western Health region, we have 12 new cases. 8 of these are contacts of known cases and connected to the outbreak, and 3 are contacts of known cases and not connected to the outbreak, and 1 is under investigation. The total number of cases in our province is now 1,334. There have been 17 new recoveries since yesterday, 2 in Eastern, 9 in Central, and 6 in Western, and there are now 90 active cases in the province. 1 person is in hospital with COVID-19. A total of 147,884 people have been tested to date. Yesterday, we issued an advisory outlining changes to alert levels in the Central and Western regions. We are seeing reduced spread in the Central Health region. New cases are contacts of other known cases, and this tells us there is a reduced risk of community transmission in that area. So Lewisport to Summerford are now moving to alert level 3, or have moved to alert level 3, and all remaining areas that were previously in alert 4 are back to alert level 2. We have received results for preliminary results based on screening in the Western region, and that outbreak has been deemed to be due to B1617, which is a variant that originated in India. We expect to have whole genome sequencing to confirm that later this week. Based on the information from public health and where they were seeing positive cases, alert level 4 was expanded to include communities along Route 403, which include Flat Bay, St. Teresa's, and Journos. This in addition to the towns already in alert level 4, including St. George's, Stephenville Crossing, Stephenville, Port-au-Port East, and all towns on the Port-au-Port Peninsula, and towns and communities along routes 460, 461, 462, 463, and 490. The investigation into the outbreak continues, and there is a possibility we may not find the source, as we have said before. But regardless of where you live in the province, we encourage you to download the COVID Alert app. This app helps public health in contact tracing and will alert you if you are a close contact of someone who has tested positive. If you have the app and you test positive, your close contacts will be notified of your identity. Over 60% of our eligible population has had at least 1 dose of COVID vaccine, right around 300,000 individuals. And while this is very good uptake, there are still time slots available this week in clinics across the province, and we encourage anyone who is eligible to book their first dose. I cannot overstate how critical it is to be vaccinated. Vaccines are without a doubt the best tool we have in our arsenal to fight COVID-19. If COVID has taught us anything, it is that no one is an island. And as long as we live in society, the decisions others make impact us, and our decisions impact others. Making the choice to receive the COVID-19 vaccine protects you from COVID and protects those around you. The more people we have vaccinated against this virus in our province, the better protected we all are. There is strength in numbers. Strong population immunity is critical to returning to the activities we enjoyed before COVID, to travel, to have parties, concerts, and festivals, to worship in the manner we choose, and to reconnect with loved ones living away. Plans are underway to begin administering second doses, and later this week, we will be coming out with notifications on how we will be moving up people to get second doses, starting with those who are booked for second doses in later July and early August. And we expect that that will be coming out at the end of this week. We will also be recommending that the dosing interval between 2 doses be 8 weeks, and down from 16 weeks, which we had said previously, because our supply now has improved. The National Advisory Committee on Immunization has released its recommendation on second doses for those who have received first dose of AstraZeneca or Covishield vaccine. Usually the same vaccine is used for both doses in a vaccine series. However, the risk of rare blood clots following vaccination with AstraZeneca vaccine and emerging evidence on mixed vaccine schedules, people who have had 1 dose of AstraZeneca vaccine now have 2 options for their second dose. They can choose to receive a second dose of AstraZeneca vaccine, or they can receive an mRNA vaccine for their second dose, such as Pfizer or Moderna. Individuals may wish to consult with their healthcare provider to help them decide which vaccine is right for them. Both options provide an effective immune response and offer good protection against severe illness from COVID-19. There is still a risk of severe blood clots known as VIT associated with AstraZeneca and Covishield vaccine, but the risk with second doses does not appear to be quite as high at this time compared with first doses. As a recap, for those who may have just joined us, we have 17 new confirmed cases since yesterday's media advisory. The total number of cases in our province is 1,334. I'm incredibly proud of the determination that Newfoundlanders and Labradorians have shown throughout the pandemic. I ask for your continued cooperation and adherence to public health guidelines in the months ahead as we embark on the transition to our new normal. Hold fast, Newfoundland and Labrador. Thank you.
Thank you very much, Dr. Fitzgerald. I'll now ask Minister Haggie to say some words.
Thank you very much, Premier. This is indeed a day to mark on the calendars. I've said many times that this has been a marathon with hurdles, and now we have a prospect of a finish line with a new normal on the other side. The plan together, again, it will be up on the website by the end of this media briefing, if it's not already gone up now. It is clear, it is flexible, and it offers us the opportunity of doing the things we like to do with the people we like to have as our company. It will start in a transition phase as early as June the 15th, and the rest of it then is kind of dependent on factors that Dr. Fitzgerald has outlined. Basically, vaccination is going to be a key here. And that's the game changer from this time last year when we were in a reopening situation. That is the real difference, with 62% of our population already having had 1 shot. Our target is 75%, and we currently achieve around 1% per day. You add on 14 days then for the vaccine to become effective, and that takes us to Canada Day. We have seen an increase in supply and reliability from Pfizer, and we know Moderna is following. That will allow pharmacists and physicians who have been keen to partner with us in vaccine administration to increase the options for distribution, and we'll be working with them even more closely to finalize those plans over the coming days. I'd just like to give a shout out to the Medical Association for their rather slick advertising campaign, heavily promoting vaccinations. As Dr. Fitzgerald has said, this is going to be a key to our progress through this plan to reopen. Similarly, I'd like to just pause and thank all the healthcare workers across the province who have, for the last 15, 16 months, really put themselves out to look after us all. We owe you a debt. The people of the province have stepped up too and need to continue, as Dr. Fitzgerald says, with the public health measures that will become a mainstay even into the fall. One group, I think, who may not have been emphasised is my own department. The staff in the Department of Health have worked round the clock every day, for some of them, pretty well since January of 2020. You don't see them, but the work that they do, you see on the website and with the advice that we are able to provide you. As Dr. Fitzgerald says, we will see pockets of COVID on and off over the coming weeks and months. What we have seen also is that local, short, sharp responses from public health have been effective and are still effective in containing these and allowing the bulk of the province to go about its activities in a way that other jurisdictions even now are trying to get to. So once again, it has been a marathon. Our last hurdles really are down to vaccine deliveries from our supplies. Continue with the public health measures, and we're nearly there. Thank you very much, Premier.
Well, thank you, Minister. A good day indeed. We'll now invite questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 7 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Our first questions are from Peter Cowan with CBC. Please go ahead.
Dr. Fitzgerald, I'm wondering how you respond to people who are worried that July 1st may be too soon to allow people in, especially on a day where you just announced 17 new cases of COVID.
So I think what we have to remember, number one, about the 17 cases of COVID that we announced today, that most of them are contacts, so not unexpected cases, and that, many of them were travel. So this is public health doing what it is supposed to do, and I think is an indicator of what we will be able to do as we continue to reopen and as we continue with this plan. So I think, I understand that people are scared. Change is difficult. We've been used to low case counts and being able to control things and living our lives fairly freely. We know that vaccinations can help to reduce severe disease, so we may see some cases, but what we know right now about even 1 dose of vaccine is that it does appear to reduce the severity of disease. So I think, we all need to still follow the rules. We all need to still take into account these public health measures, use our masks, wash our hands, keep our distance, keep our contacts as low as we can. Just because we can go to large gatherings as time goes on doesn't mean that you need to be doing that all the time or that you should. So just, continue to keep all of those things in mind. Make sure you get vaccinated. That's the most important thing that you can do.
High school students still aren't back in school full-time. What would you say to them who may be upset that they continue to not be able to be back in school full-time while we are still planning for reopening and allowing more people to travel in and out of the province?
So I think we're not doing that till later. We got another month yet. With regard to operational things with high schools, I'd have to leave that to be answered by the department, but I think we've made decisions based on what we think are the safest options, and kids will be able to get vaccinated. And as we see more children vaccinated 12 and up, our hope and expectation is that next year will be a very different school year for those children. So there's that to look forward to.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you, Dr. Fitzgerald. I know this was asked during the tech briefing, but for those listening in, knowing that to enter the province without having to self-isolate, you need to have 2 doses or be partially vaccinated, what kind of proof will be required at the border?
So our plan at this point is that the proof will have to be when the travel plan, sorry, let me take a step back there. The travel form will still have to be completed by all travelers coming into the province. And we are working through processes now that will allow people to upload their proof of vaccination to the travel form. And so hopefully that, at the border, that confirmation won't need to happen there. It'll have already happened. So people will be advised of what their isolation requirements will be, if any.
And now that people are getting a chance to work through this reopening plan here and really digest it, knowing that a lot of travel will happen with 2 doses, people obviously going to be eager for those second doses. I've heard of pharmacies that are ready to begin appointments. When can people start looking to book through their pharmacy?
The pharmacies will be getting Moderna vaccine. We are waiting on that. If you recall, I've said on several occasions before that Moderna's supply chain is somewhat erratic. We will be supplying it to them as promptly as we can get it. Again, all along, our challenge has been having vaccine in numbers. Those numbers are not controlled by us. We get our share pro rata of the Canadian population, basically. So it's coming, and as soon as it comes, we will pass it along.
Thank you.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Sorry, hi. I think I was on mute. I just wanted to ask, obviously, I think there are going to be some pretty emotional responses to today and today's plan, especially from rotational workers. I wondered if you had any kind of message for them now that we're finally at this point.
I think we probably all have messages for them, but let me first start by saying that we can't imagine the sacrifice that they put in, and are, as we've all collectively said, are incredibly empathetic to them and their families and what they've gone through in the last 16 months or so. But the finish line is here, and or certainly within our reach, and we can't thank them enough for their sacrifice, their commitment to the province. And we're very much looking forward to life beyond COVID-19, as I'm sure they are. I'm not sure if you have any further comments.
The only thing I would add, Premier, is that, we have done our best to expedite the vaccination process for rotational workers in line with NACI guidelines, and that they will no longer be treated any differently than the rest of travellers, with the exception of those who do come from outbreak sites. So I think the playing field, if they felt it was such, has levelled further, and any disadvantage they may perceive has been reduced. So I'm not sure what else to add other than that. So again, another step in the right direction.
Thank you. I don't have a follow-up. Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. With this reopening plan, when we do start reopening, does that mean that we'll officially move to alert level 1? And if not, when does that happen?
Certainly not right away. You go ahead, Dr. Fitzgerald.
Alert level 1. It's getting to be the bane of my existence. So certainly as we work through this, we think, this is the path to get us to alert level 1. Alert level 1 really is going to be looking at when travel is more free, when, much bigger events are freer, and life is almost back to normal, but, the rest of the world is not, may not be quite there yet. I mean, we know that there's still lots of countries who've got a lot of vaccinating to do, who are nowhere close to where we are with our vaccination rates, and so we need to make sure that the whole world is safe, because if one of us is not safe, then none of us are safe, and so it's really important for us not just to think about ourselves and our country here, in making sure that everyone is vaccinated here, but we need to make sure that the world is vaccinated too. So I think as the rest of the world works through vaccination, and we're at our over 80 or more percent of people with 2 doses, I think then we'll be looking at alert level 1. So.
Thank you. And the reopening plan includes guidance for a gradual return to office spaces and continued return to work. For employers now that will have to decide who to bring back, when to bring them back, what sort of guidance would you give to them?
So I think whatever people do, they have to, they have to keep COVID in mind. They have to keep those safety protocols in mind. COVID can still pop up, and there are still people who are not completely vaccinated. And while 1 dose does offer protection against severe disease, 2 doses are better. So we want to make sure that, employers are, number one, encouraging people to get the vaccine. That's very important, allowing, flexible time to be able to get the vaccine. And then to follow those protocols of physical distancing, masking in the workplace, just to reduce the risk, if there is a case of COVID, to reduce the risk of spread even further. So, our goal is, as time goes on, is that if we see cases of COVID, we treat them much as we do cases of other types of communicable diseases, that, we look at vaccination status, we look at closeness of contact, and we may not have the same isolation requirements as we do right now. So these are our goals going forward. So it's really important for workplaces to continue for right now with those physical distancing, masking, hygiene measures, and cleaning practices.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
It's been fairly straightforward up until now for people coming into the province. They just self-isolate, period. Now we're adding the vaccination equation in there. How is that going to be vigilated? Isn't that going to cause a lot more trouble?
So we don't anticipate that it will. We have a system in place for people to submit their vaccine status. Then I think that will be, we'll be able to ensure that people are aware of what they have to do when they get here, and what their requirements are for testing and or isolation. And we still have follow-up in place for those who are isolating, and that will continue. The travel form will continue. So I don't think at this point it's going to complicate things. I think a lot of the processes that we have in place already are going to be used to continue to do or to go through this plan. So I think it'll be fine.
We've seen a lot of turmoil online and in person in communities, worried about people who are not isolating, about the virus getting out. Do you feel like people are going to be a bit gun-shy about finally letting go of those fears?
I think it's going to be a bit of a change, and I think people are going to be nervous to start. But we saw this last year when we opened the Atlantic bubble. People were very fearful, but once we got into it and people realized that it's not as bad as what we had anticipated, things seemed to settle down, and people were happy with it in the end. So I think anytime we change things, it's a little bit. It brings up a bit of anxiety and trepidation, but I think, as we move through this, as we see more people vaccinated, as we see more information coming through about vaccine effectiveness, I think people will feel better about it.
Peter, the only thing that I would add there is that these phases are there for people to follow, but as we said from the very beginning, it's not like we're going to not continue to monitor the evidence and the science and the epidemiology as it evolves in front of us. And should there be a required change, then I think we've shown the willingness and the ability to do so quickly. So Dr. Fitzgerald and her team will be continuously monitoring the evidence, the real-world evidence, the scientific evidence, as it pertains to COVID-19 in our jurisdiction and others, to potentially detect any early warning signs as it would pertain to potential travel in our province. So I understand that there is significant anxiety, and as Dr. Fitzgerald said, there will be anxiety around change. There always is. But this is a step in the right direction with a safety net should we require it.
Thank you.
Our next questions are from Elizabeth Whitten with All Newfoundland Labrador. Please go ahead.
Thank you. Page 2 of the plan notes most businesses won't have to submit operational plans regarding COVID-19 compliance in order to fully reopen, but it kind of implies that some businesses or sectors might have to submit plans. So I was wondering if you could give some clarification and maybe name some of these impacted businesses.
I believe that's referring to the unless otherwise noted line. Is that what you're referring to, Elizabeth? Yeah.
Yeah.
Do you have specifics? I guess there's specific businesses that, instead of the catch-all that I believe is outlined in the package or on the website. But Dr. Fitzgerald, do you have that?
So there are some businesses that have to submit plans, especially if there's if their business requires larger gathering sizes and things like that, and then a plan has to be submitted for approval. So there are some. I mean, most of those businesses know who they are, but by and large, if we're talking about most workplaces, then those plans won't be required to be submitted.
Right. I don't know if you mentioned, they know who they are, but I don't know who they are. So I'm not asking you to name any specific businesses or target them, but, are we talking like arenas?
Yeah, so there are some businesses that would, plan events that would have large numbers of people there, or there are some that do require people to be there in larger numbers. So, as we worked through our alert levels, some of those people or businesses, had to submit plans for how they would do that safely. So those would be the ones that we're talking about.
Thank you. And I'm curious, how do the two clusters in Central and Western region impact plans for reopening, as they're both pretty big tourism areas as well?
Yeah, so I mean, certainly we're seeing decreasing cases in the Central Newfoundland cluster, and we're following it closely, obviously, but. And that's why we moved to alert level 3 for that small area, because of we just wanted to see how things go and just open it up a little bit further, take it a little bit slower. So we're certainly seeing that one hopefully wind down now. So that's encouraging. With regard to Western, it's still, we're still in the early phases of that outbreak, but public health is working through it. It is reassuring that most of the cases we're seeing are those that are contacts of cases. There is some community testing happening, and so we're not seeing the cases in that situation. So that's all really good. Those are all positive indicators for us.
Thank you. Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi. First question is for the Minister of Health. Just looking for an update. Based on the number of appointments for first doses, what percentage of the population will actually be vaccinated with one dose of the vaccine by July 1st, according to your estimations right now?
We estimate 82% by July the 1st with a first dose.
Thank you. And in terms of lifting the state of emergency, the emergency measures in general, is there a date that you're looking at or hoping to achieve?
So we're not looking at any specific dates. We'll continue to again monitor the epidemiology in our jurisdictions and others to exactly land on on when that will be suspended, but we don't have a particular date and time as this pandemic continues to evolve. I think it's appropriate for that decision to be evidence-based and not chronologically based.
Our next questions are from Peter Cowan with CBC. Please go ahead.
We're seeing that you mentioned that it looks like the variant on the cluster on the West Coast is B1617, which is the same variant that we saw in the cluster in Central. Does that mean, is there any indication that these two clusters might be linked?
No, we don't have that. Certainly don't have information to indicate that at this time. It's difficult to know. Certainly the whole genome sequencing analysis will give us some ideas, but you know, there are outbreaks elsewhere in the country, and so those outbreaks can see the same variant in different places. So even if they are similar, very similar variants, that doesn't necessarily mean that the two outbreaks are connected. Right now, there's no epidemiological link between the two outbreaks that we can discern, or that the public health staff in Western Health can discern. So it doesn't appear that they're connected in that regard.
For more than a year, COVID has been something that Newfoundland and Labrador has aimed to avoid at all costs. And as we open up, you've indicated that it's likely we will see some cases, but because of vaccinations and other things, it'll be manageable. How difficult an adjustment do you think that's going to be for people in Newfoundland and Labrador?
I don't know. I think, you know, we've proven, and Newfoundlanders and Labradorians have proven time and again throughout all of this, throughout the last 15 months, how resilient and malleable, or not malleable, but how adjustable, I guess, they can be. And I think, I really think that they'll continue to rise to that challenge. I think, you know, it's quite scary. It was quite scary in the beginning when we didn't really know what this virus would do, what it meant for all of us. But we've come to know it, and I think we've all developed a certain knowledge about it, and we're able to manage it. You know, we don't see the same fear and anxiety with these outbreaks that we did before. People are responding appropriately. People are doing what needs to be done. They understand that they have it within their power to be able to help control these outbreaks. And I think, you know, as we see more people vaccinated, and as people realize that, you know, the vaccinations will protect and will help us will help protect our health system capacity, I think they'll be able to adjust with that as well. I have every confidence that people will be able to move forward with this and do what needs to be done.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. I'm wondering, with our vaccination numbers, if that includes Newfoundlanders and Labradorians who've been vaccinated outside of the province but are residents of Newfoundland and Labrador. I'm thinking rotational workers who may have received their first dose while working away.
That's a good question.
I think the short answer there, Kellyanne, is no. Those are related to doses that we have administered to people we have had in the province when they've had their first dose. We have a national network which will fill in the gaps, but those are our numbers.
Okay. I'm wondering, is there a timeline on when that might be included in our numbers? And then also on AstraZeneca, how will people be able to inform on which vaccine they want for their second dose?
Yeah, so they can book that when they book their appointments. They can indicate that they can book for the clinic that they wish. Is my understanding at this point. So.
Okay, so for those, just to clarify, for those that have their second dose that's already been booked, looking to rebook those, or when they go in, they'll just clarify there.
I'll have to take that back, Kellyanne. To be quite honest with you, I don't have that that information right now, and it may be different with each RHA depending on how they have to operationalize it. So I wouldn't want to speak out of turn and say something wrong.
No worries. We'll follow up later.
Yeah.
Thank you.
Thanks.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Hi there. I just wondered where this leaves St. Pierre and Miquelon. Will the province make a request to the federal government to open the border, or will they have to wait for the international border restrictions to ease?
I've been chatting with Minister LeBlanc on that very question. And we'll also need to chat with the Atlantic premiers, as it may have some downstream impacts to them. So it is an active discussion and no decision just yet, but it's certainly an active discussion between myself and the federal minister.
Okay, thank you. I'm fine. I don't have to follow up.
Okay, thanks, Sarah. Our next questions are from Richard Duggan with VOCM. Please go ahead.
Going back to the B1617 variant for a second, as we've mentioned, it's responsible for the West Coast and Central clusters. It's been said before that eventually one variant does start to dominate once variants are introduced. So is B1617 now the dominant variant in Newfoundland and Labrador?
Well, I mean, it is the dominant just because that's the most cases that we have are due to that. But, you know, variants are pretty much what we're seeing now, or variants of concern, I should say, or what we're seeing right now. You know, this variant appears to be somewhat more transmissible even than B117. So if it's more transmissible, we certainly would expect it to become the dominant strain. That's sort of part of evolution and why the reasons, you know, adaptation leads to success. So, yeah, we would expect that a more transmissible variant would become the dominant variant. And so I would not be surprised if that's what we see going forward.
Okay, and some maritime provinces are introducing a rebate program for visitors, giving them back 20% for staying there. Is there any thoughts of doing something similar here?
That's not something we've considered at this point, Richard.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
I just have one really, and it's a clarification. I believe you said that the cluster in Central was B6172. Is that the same as the Western, or is the Western not have that extra numerator?
So while the reason we say that the Western is 1617 is we have done what we call a screening test. So that just looks for that section of what we call the genome of the virus. So we can't tell which sublineage it is. So the 0.1, 0.2, or 0.3 of B1617 until we do the whole genome sequencing. So we won't have that till later on this week.
Okay, thank you. That's it for me.
Thank you, Peter. Our next questions are from Elizabeth Whitten with All Newfoundland Labrador. Please go ahead.
Thank you. This question is for the Premier. New Brunswick recently announced they were going to start financially incentivizing travel to that province, and now that, you know, tourism operators, I'm sure they've had their eye to this, are basically getting the go-ahead for a July 1st opening. I'm wondering, is the Liberal government here considering a similar financial incentive?
That's not something that we've considered at this particular moment.
All right, then. Thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi. The getting to phase 2 requires 50% of the population having a second dose by August 15th. Does that mean that we're going to have to significantly ramp up vaccine delivery between now and then? I'm just knowing the short time frame there. Can you explain how that's going to work?
Well, once the majority of people have had dose 1, the regular vaccine supply will be used for dose 2. So we would expect that we would be able to do at least 1% per day for increasing the percentage of dose 2. once we'd got through all those who were eligible who wanted one. In addition to that, there's the Moderna vaccine, which is expected, and we have, again, promises of significant numbers of that at the end of June or early July. I'll wait and see when that actually arrives, but that will certainly help. And there's also now flexibility in that NACI guidelines don't stipulate that you need necessarily. Ideally, you should have the same vaccine in the series, but if there is a challenge in doing that, then you could mix Pfizer and Moderna and vice versa, as well as AstraZeneca. So I don't see necessarily we'll have a problem. Our only constraint in achieving those will be if something we haven't foreseen happens to the vaccine supply.
And my second question is related to the Atlantic bubble. The other provinces in Atlantic Canada have announced a date for reopening Atlantic Canada, then reopening to the rest of the country. Why did we choose a different approach of going straight to a sort of a nationwide reopening the border?
Well, right now there's no consensus amongst the Atlantic premiers on what the bubble looks like conceptually or in practicality. So, in practice, So we are still talking to the Atlantic premiers, but essentially this creates an Atlantic bubble, if you will. New Brunswick is out with a plan that essentially is somewhat aligned with where we are. So you could argue that there is a bubble, but the greater bubble is the Canadian bubble, and that's where we're all kind of geared towards right now. But hasn't been an exact consensus, but those discussions are still ongoing with respect to what a bubble would look like in light of the New Brunswick plan, in light of our plan, in light of PEI's plan, and how it pertains to testing, vaccination status, or just freedom of mobility without either one of those. And those are still live conversations.
Thank you, everyone. Premier, do you have any final comments for today?
Thanks, everybody, for joining today. It's a great day. I know it will be met with some anxiety, and I can appreciate that. But once again, I want to end with where we started, that we have shown that we can react. We will react when needed and take any decisive actions required should the evidence and the science and the epidemiology prove that we need to. Right now, this is a plan to reopen. It's a good, solid plan based on evidence. And I think people should take great comfort in that, in Dr. Fitzgerald and her team for doing the hard work to get us to where we are and to create the path forward. And I'm very much looking forward to a different summer than we had last summer. So please, everybody, do your part, get vaccinated, follow public health guidelines, and this summer should hopefully look very different. Thank you.
Thank you, Premier. Stay safe, everyone. Take care of yourself and each other, and enjoy the rest of your day.
Of the preceding program, we now join the regularly scheduled program already in progress.
Focused on quality and convenience, there isn't much you won't find at Marie's Mini Mart. Home-style breads, sandwiches, plus a variety of artisan breads and delicious single-serve desserts available exclusively at our Frecker Drive location. Marie's Mini Mart, with 25 locations wherever you go, there we are.
Yellow Belly food means fresh food. We source our ingredients locally and prepare them from scratch. Our meat is never frozen. Food's so delicious, we've got Good Times cornered. Yellow Belly Brewery, a proud sponsor of One Chef, One Critic.
My name is Matthew Rutledge. I'm a 60 scoop survivor, born in Red Lake. Was adopted from there to Toronto at the age of 4. A lot of our brothers and sisters, family members got separated from each other. That was the government's goal, to break that connection from brothers and sisters. Basically taking the Indian out of the child.